Carol.
Okay, we got this.
Got
Got
it.
this, Sam.
Stage 4 of labor starts with the delivery of the newborn. True or false? That is false. It starts with delivery of the placenta. Only breastfeeding moms should be encouraged to perform skin-to-skin contact in the immediate post-delivery period. True or false? That is false. Everybody should be skin-to-skin. If they can't be skin-to-skin with mom, then skin-to-skin with somebody else is fine too. So if mom is unstable, we can always put skin-to-skin with another family.
I've decided my phone just makes it slow.
Moms who are not breastfeeding should be encouraged to bind their breast or wear a tight-fitting sports bra. True or false? That is true. Education about Kegel exercises should be provided during the postpartum period. That is true. During pregnancy and in the postpartum period, there is an increased risk of blood clots. True or false? True. Postpartum assessment includes fundal, perineal, and breast assessment. True or false? That is true. Oh, not only, just includes them. Patients with a history of depression are at higher risk for developing postpartum depression. True or false? True. Screening for depression risk should begin before infant delivery. True or false? It's true. We typically do it on admission to labor and delivery. We also do it in the postpartum period, and then once they go home, they're screened again. Postpartum depression and postpartum psychosis are the same. True or false? False. Which one's worse?
Psychosis.
Pain medications such as naproxen are commonly used to manage postpartum pain. True or false? Signs and symptoms of DVT include chest pain and shortness of breath. True or false? Okay, that's false. What are those signs of? PE. So if it moved. Okay. And if they are having symptoms of a PE, who do they call? 911.
Okay. Yeah, I was thinking PE is a little like.
Yeah.
It's a result of the DVT.
It is a result of a DVT, yes.
They're the same.
It's a complication of DVT. White blood cell count and red blood cell count are expected to decrease following delivery. True or false? That is false. The red blood cell count we usually drop some, but the white blood cell count we usually elevate. In the postpartum period, the fundus should be midline and boggy upon palpation. True or false? That is false. It should be midline, but the uterus should be firm, not boggy. Involution is the process by which the uterus shrinks back to its pre-pregnancy size. True or false? True. What is if it doesn't shrink back properly? Involution. A fundus that is deviated to the right usually indicates a full bladder. True or false? True. Lochia rubra is considered expected for the first 2 to 3 days following delivery. True or false? Also true. Lochia is the general term used to describe the expected vaginal discharge following delivery. True or false? True. When assessing lochia, an area of approximately 4 inches on a period pad is described as moderate. True or false? That's false. 4 is small, 6 is moderate. Saturating a period pad within 1 hour is documented as a large amount of bleeding and is expected in the early postpartum period. True or false? always abnormal if they have large or copious. A perineal laceration is a surgical cut that allows more room for baby to deliver. True or false? It's false. A laceration is a tear. What is a cut? Episiotomy. First and second degree lacerations are common and usually have no long-term complications. True or false? True. All mothers should be encouraged to breastfeed their newborns for at least 6 weeks. True or false? And this is false because of the
Their
all.
decision.
Okay, it is their decision, but even if you were gonna say breastfeeding is best for everyone, there are at least one population group that we absolutely do not encourage breastfeeding, and that's your HIV positive moms. So the all is the key there, okay? So for most moms, we absolutely want to encourage breastfeeding, but not all mothers can breastfeed. Okay? Prenatal vitamins are encouraged during the early postpartum period. True or false? That is true. So at least 6 weeks for everybody, and if they're breastfeeding, they need to continue their prenatal until they stop breastfeeding. Indications for C-section delivery include cephalic presentation. True or false? False. Cephalic is head down, which would not be a reason to do a C-section. VBAC delivery is a viable option for all mothers who have had a previous C-section. True or false? That is false. Not all mothers can have a VBAC. There are certain requirements, so we have to have something that has been fixed, and there, so not all mothers can have that. During the first 24 hours, warm packs can help to provide comfort and decrease perineal swelling due to childbirth. True or false? False. We use cool packs or ice packs for the first 24, then you can switch to heat. So the ice pack helps with swelling and it helps to prevent bleeding, and then the warmth helps for healing. Baby blues are common during the postpartum period. True or false? True. Signs of infant bonding include face-to-face holding and talking to the newborn. True or false? During the taking in phase, mothers usually talk about their experience and allow others to do for the newborn. True or false? Also true. Early postpartum hemorrhage usually occurs within the first 6 weeks following delivery. True or false? That is false. Early occurs usually within the first 24 hours. Late is what you can see up to 6 weeks postpartum. Early is usually caused by uterine atony, and late is usually caused by what? Retained placenta. Uterine atony is a common cause of early postpartum hemorrhage. True or false? Signs and symptoms of mastitis include fever, erythema, and painful swelling of the breast. True or false? True. Some medications such as oxytocin and misoprostol can be used to induce labor or to treat postpartum hemorrhage. True. Misoprostol is listed as a category X for pregnancy. True or false? That is true, because it can cause a loss of pregnancy if given early in pregnancy. Patients following C-section delivery do not experience lochia rubra. True or false? That is false. They're going to have the normal vaginal discharge just like any other delivery. Repetitive late decelerations would be an indication for a C-section delivery. True or false? True. Lanugo is the white cheesy stuff noted on the newborn. True or false? False. What is Lanugo? What is the white cheesy stuff? Preterm babies tend to have more Lanugo and vernix. True or false? at-birth scoring is performed to help determine infant status in the immediate post-delivery period. True or false? That's true. The day cohort had the same response to that little baby. Bless it. An at-birth score of 8 or greater is considered within normal limits. True or false? That is true. So 8 or above is fine. Less than 7, we need to be intervening. An infant who is crying, active, and pink with a heart rate of 98, a respiratory rate of 24 is giving an at-birth score of 10. That's false. Automatically, we know that heart rate's not going to give us a 2, so it has to not be a perfect 10. Very few babies are going to get a perfect 10, because almost all babies are going to get counted off for color, because they're going to have little blue hands and feet. So if you're one of the lucky ones that got a perfect 10 on your at-birth score, you are an anomaly. You are not one. All right, when providing newborn education to the parents, when providing newborn education, parents should be instructed to suction the nose first, then the mouth. True or false? Newborn security includes the use of location devices that track infant locations at all times. True or false? That is true. Last thing that comes off the baby is that security man.
Will I need to take the test today?
I know. Infants should be banded following delivery with an ID band that links mom and baby. True or false? True.
If the test was just on this.
I know. A newborn heart rate should be between 110 and 160. True. Skin-to-skin contact is only used between moms and babies. True or false?
Right.
That is false. Anybody can do skin-to-skin. So if mom's not able to, if there's another family member or the dad, we'll usually bring them in with them do skin-to-skin. Swaddling is used to help keep baby warm and secure. True or false? To avoid SIDS, the patient should be placed in the baby should be placed in a supported prone position. True or false? That is false. Prone is stomach down, they're going to be on their back, so supine position. Bottle-fed babies tend to eat more frequently than breastfed babies. True or false? That is false. Respiratory distress in a newborn includes grunting, retractions, and nasal flaring. True or false? True. Newborn oxygen saturation should be 95 or greater at 1 minute of life. True or false? That is false. It can take up to 10 minutes for them to get to 90%.
I'm not cheating, but I'm not competing either.
Proper cleaning and diapering can reduce the likelihood of infection. True or false? That is true. Always with your little girls, you're gonna wipe front to back, clean front to back to prevent infections. So proper cleaning is very important. All newborns should be screened for PKU, hearing loss, and heart defects. True or false? That is actually true. We screen them all. A flexed posture is considered a normal newborn finding. That is true. So flexed is going to be kind of drawn in. Think of fetal position. So that is a normal position for a full-term baby. All moms should be encouraged to consume 500 extra calories in the early postpartum period. True or false? That is false. Who needs to increase their caloric intake? Who won earlier?
Same. Not competing, not cheating.
Okay, now, what we have left is your growth and development stuff, which is not gonna take long. I do have a Kahoot for growth and development if y'all wanna do it, or I can post it. We're gonna at least go over this. So if you will get out the handout that I gave out earlier, growth and development, you have cerebral palsy, you have failure to thrive, and Down syndrome. And you have your lovely growth and development milestones and all that. And show y'all where these two things are. The one that I gave out is gonna be this overview right here, so if you wanna do it digitally, you have a digital copy of that. You're only responsible for the highlighted part that we're fixing to do, okay? Now, for your growth and development key points, have a good night.
You too.
Because normally I'm rushed to get this content in, I did something that you're probably not gonna see me do routinely, but I went through and took the topics and condensed it into 2.5 pages.
Thank you.
Okay. So, if I'm gonna ask you a question on anything, it will be on here. So at the end, I will go over what to focus on, if y'all will remind me, but you don't know, that is there, you can use it, okay? All right, on this growth and development overview, only the following things will be fair game for the test. So we're gonna go nothing on 1 month. On 2 months, you're gonna go all the way under social and cognitive, and you're gonna highlight smiles and coos at familiar faces. Okay. For 4 to 5 months, you're gonna highlight in that first column, no head lag. So by the end of 4 months, that head lag that you see babies have should go away, okay? Yeah, no more bobbleheads. For 6 to 9 months, in that first column, you're gonna highlight weight doubles and sit up unassisted. For the third column, you're gonna put no babbling by 9 months equals report. In that fourth column, you're gonna highlight separation anxiety starts. Okay. In the 10 to 12 months, the only thing you're gonna highlight is in the far right column for purposeful play. So they begin to build and sort and stack. For 12 months, in the first column, you're gonna mark weight triples. In the second column, you're gonna mark fully developed pensar grasp, meaning that they have a little bit more fine motor skill. And in that fourth column, you're gonna mark develops object permanence. What is object permanence?
Where it doesn't disappear.
You got the ball, you put it behind your back, they know it still exists. It didn't just completely vanish, okay? It's just out of sight. For 18 months, in that second column, you're gonna highlight scribbles with a crayon using a fist hold. In the third column, you're gonna highlight 10-word vocabulary. And in the fourth column, you're gonna highlight anger, temper, and ownership. Everything is mine, mine, mine. And if you will also highlight begins parallel play. For 2 years, you're gonna mark in that first column walks independently. In that second column turns pages 1 at a time. In the third column, they will say their own name, and I just think it's kind of cool. They have a 300+ word vocabulary, which is insane. Under 3 years, in that first column, you're gonna mark walks up the stairs with alternating feet, meaning they walk as a normal pattern instead of step up, bring it up, step up, bring it up. In that second one, you're gonna mark spoon feed self. Bless us all. In that third column, you're gonna mark ask why a lot. Everything is why, why, why. In the fourth column, they do begin associative play, and this is when they start to have imaginary friends. Second page for 4 years, under gross motors, that first column, you're gonna mark skip and hop on 1 foot. Under language, they can memorize their ABCs and 1, 2, 3s. And under social and cognitive, they begin cooperative play. Under that, there's definitions, so if there's anything you have a question about, they've been defined there, so like purposeful play and parallel play, just kind of refer back to that. For your vital signs, don't worry about the blood pressure, but you do need to know the normal heart rate and the normal respiratory rate for the newborn. Under immunizations, I am not asking you to memorize that immunization scale, so if you'll just go to the very bottom and just mark those two little bulleted points. So just for frame of reference, if you ever get an immunization question, MMR, hepatitis A, and varicella do not start until 12 months old, and then I do want you to know which ones are live vaccines. Okay? We'll do that. All right, under your module here, you will see everything that I could potentially test you on based on cerebral palsy, Down syndrome, and failure to thrive. So what I am gonna do before I let you get out of here is start to finish antepartum through growth and development. I'm gonna give you some keys that you need to make sure you review. This is not all inclusive, but it is helpful. Are you ready?
You did it.
All right, know your antenatal testing and when nursing interventions are needed. How about I go over it and then somebody just come make a picture of it and you just post it for everybody? That's all right, good one? I'm gonna go over it, so if you have any questions, you stop me and ask me. Deal? All right, know antenatal testing and when the nursing intervention is needed. For example, if we have a positive RPR result at whatever week gestation, we're gonna treat that immediately. The intervention is done immediately. If they're group beta strep positive, the intervention is not done until they're in labor, okay? Be sure to know education regarding exercise, nutrition, and common discomforts. I promise you, you will see a gravidoperia T-PAL and or a Nagel's rule question. It is just inevitable. Make sure that you can distinguish between discomforts of pregnancy and danger signs of pregnancy. So round ligament is a discomfort, contractions is a danger sign, vaginal bleeding, danger sign, okay? Fetal heart rates. Make sure that you can describe fetal heart rates in word form and looking at a strip. I give you strips, Casey likes to give you words. So how would you describe a late D cell, an early D cell, or a variable D cell in words, okay? And what action are you gonna do for it? Make sure you review the stages of labor and the nurse's role for each stage. Make sure you review pain management options. For postpartum, normal versus abnormal assessment findings and what you're gonna do about abnormal findings. Signs and symptoms of postpartum complications. There was 4 main ones that we talked about. For newborn, at-birth scoring, remember you're not gonna be given that at-birth scoring system. You do have to know the parameters for it. And then basic intervention for that. Signs of respiratory distress, which we covered several times today. Those normal newborn reflexes that we covered. What are the nursing actions at deliveries? We talked about making sure that you clear the airway, you dry and stimulate the newborn, those type things. Newborn assessment and newborn education related to like cord care, bulb syringe, swaddling. Signs and symptoms of complications, we mentioned hypoglycemia, transient tachypnea of the newborn, jaundice, cold stress, so those that were covered on the PowerPoint are the ones you'll be tested on. Circumcision care. Basic feeding method, and we'll elaborate on that a little bit more in Sim Lab tomorrow. Common medications that are used during pregnancy, labor, postpartum, and newborn. It will be something that will have either been on your prep work or we covered in class, probably covered in class. Newborn medications, there was 3 that we covered. We covered vitamin K, hepatitis B, and the erythromycin. Newborn hearing screens, we covered 3, congenital heart defect, hearing, and the PKU or the Hill stick. For your growth and development, make sure that you know the physical findings associated with Down syndrome. What are the key characteristics that you would see in a newborn that would tell you that this baby likely has Down syndrome? What are the comorbidities that we see with Downs? And there's a lot of them. Thyroid issues, heart problems, leukemia. There's a lot of comorbidities that we see with Down syndrome, which are listed here, so just make sure you review them. For failure to thrive, just a general overview of what failure to thrive is. For failure to thrive, there are 3 main causes, and I have listed different reasons that fall under there. So for instance, the 3 main causes are either gonna be the decreased caloric intake, decreased absorption, and increased metabolic demand. So if I gave you different scenarios, could you classify them, i.e. what's right here, right, into one of those categories? For instance, if the mom is neglecting the baby and not feeding them, that is a decreased caloric intake, right? If they have a congenital heart defect, that is increased metabolic demand. That's what's causing the issue. For CP, we're gonna cover spastic CP because it is the most common type. So what's listed on there is the spastic form with the medications that will be associated with it. So just a general overview of CP, including common causes. CP is almost always caused by some type of hypoxic or brain injury at or around the time of delivery. So it could be a traumatic birth, it could be repetitive weight decels and they're not getting enough oxygen, or something in that immediate post-delivery period like meningitis or kernicterus where they have elevated bilirubin levels that causes brain damage. Basic interventions for CP, and honestly, the answer is pretty simple. They're gonna be multidisciplinary with speech, occupational therapy, and physical therapy. What's the difference between occupational therapy and physical therapy? If you had to give me,
One fine motor
yeah,
skills.
so which one does fine motor?
Occupation.
Okay, and physical therapy does gross motor, okay? And then the growth and development milestones that we highlighted in the overview. So, this is a lot of content, but you kinda know what to focus on. So what I want you guys to do, so how many of y'all have SimLab tomorrow? The others have it on Thursday. So between now and SimLab, just kind of briefly look over this. If you have anything that is pressing, or you're like, I don't have a clue what this is, we will spend some time on it in SimLab. So SimLab is twofold. You're doing your 115 stuff, you're doing my stuff. For me, we're gonna do a really quick overview of what to expect in your OB clinical and kind of a rundown of everything that we've covered. So it'll be like a 2-hour wham bam review, get you ready for clinical, review the topics. So if there's anything specific that we need to talk about, that is your time in a small group to ask me whatever you need to feel like you're prepared for the test. Fair enough? What questions y'all have for me? You're gonna repeat out of you?
Oh, wait, somebody need a photo.
Oh, yes, please take
Show-
a
Are you doing it?
I need it.
Are you, did you get the photo, did you take the photo, or you?
Did you highlight it?